Hey, future RN, welcome to ClearPath NCLEX. Today, we are diving deep into ACE inhibitors. I'm telling you, this is a medication class you are absolutely guaranteed to see on your exam.
Yep, that's right. They are one of the most tested cardiac meds out there, used for things like hypertension, heart failure, the whole shebang. So stick with me, and by the end of this review, you are going to be able to tackle any question about them with total confidence.
So here's our game plan. We're going to cover how they work, their top uses, the absolute must-know side effects, your essential nursing care, and then we'll wrap up with a quick NCLEX drill to make sure all this information really sticks. Let's get right into it.
First things first, how do these things actually work? And trust me on this, if you can really get this part down, you can figure out the side effects and the nursing actions without just trying to memorize a giant list of facts. It's the secret to getting these questions right.
It really all boils down to this one enzyme, Angiotensin-Converting Enzyme, ACE. Its whole purpose in life is to create this substance called angiotensin-2, which is the body's most powerful vasoconstrictor. Seriously, think of it as the master squeezer of your blood vessels.
So here's how it goes. The body makes angiotensin-1. Then the ACE enzyme steps in, ready to convert it into that super powerful angiotensin-2. But here's where the magic happens. An ACE inhibitor jumps in and basically says, nope, not today. It blocks that conversion. So without angiotensin-2, what happens? The blood vessels finally get to relax, they vasodilate, and the blood pressure comes right down. See? Simple as that.
And how are you going to spot these drugs on the NCLEX? Just look at their last name. They all end in PRIL. Lisinopril, Captopril, Enalapril. If you see PRIL, I want you to immediately think ACE inhibitor. It is a fantastic little shortcut for the exam.
Okay, so we know they cause vasodilation. Now let's connect the dots and look at why that's so incredibly useful and what we actually give the ASI pearls for.
The top uses all make sense once you understand that vasodilation. For hypertension, well, relaxing the blood vessels lowers blood pressure. For heart failure, it makes it easier on a struggling heart by reducing its workload. After a heart attack, or an MI, they actually help prevent the heart muscle from changing in damaging ways. Oh, and they also have this amazing protective effect on the kidneys, which is exactly why we use them for diabetic nephropathy.
All right, let's move on. This next part is pure NCLEX gold. If you only remember one thing from this whole review, please make it this. We're talking about the side effects, and I've got a super easy way for you to remember them.
I want you to just remember the name of the drug class itself, ACE. A is for angioedema, C is for cough, and E is for elevated potassium, also known as hyperkalemia. Just burn that into your brain, ACE.
Now let's talk a little more about that cough. It's not just any cough. We're talking about a persistent, dry, hacking cough that can really drive patients nuts. So why does it even happen? It's because ACE inhibitors also stop the breakdown of this other substance called bradykinin. So more bradykinin leads to this super annoying cough. And believe me, this is a classic NCLEX question.
Okay, so we know the side effects. Now let's connect them directly to what you, the nurse, are actually going to do about them. This is where you score those big points on the application and analysis questions.
So for A, angioedema. If you ever see swelling of the lips, face, or tongue, that is a medical emergency. Your number one priority is to assess their airway immediately. For C, the cough. You need to assess their lung sounds. Is it just the harmless drug side effect, or could it be fluid overload because their heart failure is getting worse? You have to figure that out. And for E, elevated potassium, you're monitoring their potassium levels. Anything over 5.0 is a big red flag. You'll also want to watch the EKG for those tall, peaked T waves. And, of course, since these drugs lower blood pressure, you have to monitor for hypotension, especially after that very first dose.
All right, you've got the knowledge. So let's put it to the test with a quick drill. I'm going to read the question, I'll pause for a few seconds to let you think, and then we'll go over the answer and the rationale. You ready? Okay, question number 1. A patient on Lisinopril develops a persistent, non-productive cough. What is the nurse's best explanation for this side effect? Go ahead and think about it for a second.
And the answer is, the cough is due to the accumulation of bradykinin. Remember how we said ACE inhibitors don't just block angiotensin-2, they also increase the levels of bradykinin, and that's what causes that classic dry cough.
Question 2 is up. Which electrolyte imbalance should the nurse monitor for in a client taking an ACE inhibitor? Think about our mnemonic. What does the E in ACE stand for?
And you got it.
It's hyperkalemia, or elevated potassium. See, by blocking angiotensin II, these drugs also reduce aldosterone levels. When there's less aldosterone, the kidneys get rid of sodium and water, but they hold on to or retain potassium.
All right, last question, and this one is all about priority. A client on Captopril reports swelling of their lips and tongue. What is the nurse's priority action? What do you do first? Your priority is to assess the client's airway. This is our A from the mnemonic. In real life, swelling of the lips and tongue is angioedema, and that can close off their airway in minutes. Remember, for the NCLEX, airway always comes first.
Fantastic job working through those questions. See, you absolutely have this. Let's just do one last super fast review of the key takeaways.
So here's your cheat sheet. ACE inhibitors end in PRIL. They work by blocking angiotensin II, which leads to vasodilation. The key side effects are ACE, angioedema, a dry cough, and elevated potassium. Your job as the nurse is to monitor their blood pressure, their potassium levels, and their renal function. And you have to teach your patient to report any cough or swelling and to avoid those salt substitutes, which are just packed with potassium. Honestly, if you can master the dry cough and hyperkalemia, you are going to crush these questions.
Thanks so much for watching. If this review helped you out, please give it a like and subscribe for more high-yield content. And don't forget to hit that bell so you never miss the next NCLEX tip. And drop a comment below. Which ACE inhibitor side effect will you always remember now? I read every single one. You are doing an amazing job. Keep studying, you've totally got this, and I will see you in the next one.